After several months of him saying, this isn't working what we're doing, we need to get an MRI.
Yancey Scott suffered with back pain that wouldn't go away, so his doctor ordered an MRI at the hospital, a test with a $3,000 price tag.
I said, so I got to pay 10% of that. That's $300. I thought, well, I'm not going to pay $300. I don't want to pay $300 if I don't have to.
School teacher Jennifer Jacobson just shelled out hundreds of dollars for a CAT scan at a hospital. Then her doctor said more expensive tests were needed.
My portion was about $600, which is a lot of money. $600 is a huge expense.
You could call it sticker shock, and more people are feeling it as the costs for medical tests continue to rise. So, minutes before his scheduled MRI in the waiting room at the hospital, Yancey made a phone call.
So I called them, and they were able to look at the doctor's orders and get me in within 2 or 3 hours, and the price was half.
Jennifer, meanwhile, saw an ad in the paper.
The price they quoted me was about $300 less than what the hospital quoted me.
The they in this story are smaller medical clinics like the Mountain Medical Imaging Center in Ogden.
The added cost of overhead from the hospital increases the price for everything that's done in the hospital.
Dr. Ronald Ruff, a radiologist, works with hospitals and says they are important to save lives, but there are outpatient facilities that offer the same tests, even surgery, for much less.
Our imaging center has a negotiated rate with the insurance company for providing that service.
So you can get an MRI, save money, and never set foot inside a hospital. It's a one-stop shop for patients like Yancey.
So they ended up saving me, $300 down to $80.
And school teacher Jennifer, who is still reeling for the bill from her first test.
You know, I'm mad that the hospital was charging more, but I'm mad at myself for not doing a little bit of research.
If you're talking to your family physician, you need to ask.
Patients are not obligated to go to the first place a doctor recommends. Ask for other choices.
A doctor in today's expensive healthcare environment, I think, owes it to patients to be able to discuss cost with them. Okay? I think it's just the reality of the world today.